All right, and welcome to our next session called Because Health Matters. We've got another really cool story about the people and the technologies that are really transforming the life sciences industry. I'm really excited to share the stage with Ahmed from Medullan. This is a really cool story with an incredible company. I know that you've heard of them, but we're going to kind of get the behind the scenes on the journey to today. So Ahmed, welcome.
Thank you so much, Frank. I appreciate it. It's an exciting time to be talking about this, right? Some of us have waited over a decade to take center stage on on the subject of digital and technology and how it's impacting medicine. And I mean, it's a timely topic. So I appreciate being on the show.
Oh, it's great to have you. Now, you've got a great background. I'd love to hear more about that background so we can share it with everybody, and then tell us about like what happened where you ended up creating a company.
Yeah, it's a good question. So it's a bit of an immigrant story, right? Came over to the States from Tanzania to go to school here in university. After that, I was recruited pretty early. So this was when things were getting exciting in the dot-com era. I mean, before the dot-com era, but creeping up to IT taking over the world. I don't know if you remember that era, Frank. So I was recruited early out of school. I had a background in software engineering, some hardware as well. I worked at a company called Sapient, which was a Fast Five company back in the 90s. It's now a much larger organization. From there, went through the dot-com era with a few startups, internet companies. Learned a lot, and I was recruited into the health system. You know, Partners Healthcare was known back then. Now it's Mass General Brigham in the Boston area, and I was leading their technology group for research. And it's an interesting time to have entered the hospital space, looking at very complex problems with clinical data, research data. There was a mandate, across the system to pursue personalized medicine and personalized healthcare throughout the patient journey. And we came close in many ways, but in many ways we didn't. But things have changed a lot, and that's really what inspired me to start the company Medullan. That was 16 years ago now, so it's been a while. That's before digital health was digital health. It was health IT, and then it was M-health and e-health and all sorts of things. And now we've sort of settled on digital health, but been an exciting journey.
That's really, really cool. So let's talk about the company journey as well. So what did Medullan start off doing, and how is that different from what you're doing today?
Yeah, Medullan has really gone full circle. So as would be expected, right? So coming from the working inside the hospital system, when I founded the company, I wanted to continue working with health systems, and it was very rewarding work, right? So same problems, technology strategy, data strategy problems, things that still bog us down today. You know, Frank, it's pretty amazing. But that's what we worked on for a while. But we evolved. We soon found that there was a lot more going on in personalized healthcare. It was not just being defined by the health systems, of course. So we started working with what were the early days of digital health companies, you know, the WebMDs of the world, the Red Brick Healths, who have all grown up and become different companies these days. Some are the larger forms of their own self. Some have been acquired and rebranded. But in that whole process, we ended up really figuring out the healthcare ecosystem. You know, who pays for this? So we started working for the large payers, especially in the US, who are in turn looking to work with those very same early stage digital health players. And back then, that's who funded digital health. You know, it was the payers and in some part the providers. At that point, biopharma, I would say, was not really the place to go for digital innovation, right? But now things have changed. So you can see the baton has really matured. You know, that payer provider space has matured. They have insourced a lot of things that they're working on. They've come up with centers of excellence that are productive. They've acquired and diversified themselves. You know, you can't really recognize some of the payers when you look at them today in the US because they have completely different business lines. Right? And that's a lot of that was driven by technology adoption and digital transformation. So the time has more recently come to biopharma and digital, right? And so we shifted to where medicine was being redefined as a company. So it's a little bit full circle. So I worked in the hospital where medicine, the practice of medicine was the thing, and the development of medicines was the thing when it comes to clinical research, all the way through how the digital innovation landscape changed. And now we see biopharma investing heavily in digital. And again, it's back to medicine. So biopharma invests in how does the practice of medicine work today? I'd like to learn more, be part of that conversation, right? or what are the new medicines that can be developed with digital, right? Digital medicines, therapeutics and diagnostics, as well as how do I develop my medicine with digital in clinical research in a more profound way. So now we've come full circle, and of course we're always harking back to all the people we met and worked with in payers and providers, because it's a team sport, right? So biopharma and digital can't do it alone either. You have to partner and work with all the other players. So it's been a circle of life kind of story, Frank, from when we were in the hospital all the way throughout, and now we're sort of back approaching, health systems to help us out and to work with our pharma clients.
Very, very cool. Love the circle of life story. So let me ask you, what are the difficult problems from your view that you see pharma facing right now?
Yeah, I think that's an interesting question, right? So I think everybody got some sort of wake-up call, just given the pandemic, right? And some of the reactions and difficulties that you're talking about were of the tactical nature. They needed to be done anyway, but they were just not as high a priority, whether that's more advanced remote detailing and using AI to better understand where business intelligence is going and things like that. But I think there have been some fundamental questions that haven't been fully answered yet, Frank, for biopharma, and that is when it comes to digital, what's the right to play for biopharma, right? Should we be the ones doing all this interesting digital stuff? There are billions of dollars going into the digital therapeutic space and the digital health space in general. How much of that should be biopharma's role? What should they be doing about this? And I think that's one of the big challenges, really, is just answering that question. What should be our role? How should we deliver? How should we partner? And I think the second question is that biopharma has a tried and true process that's come through a lot of history, right? Drug discovery history, regulatory history, the coming of age of the FDA, and so on, that really kind of structures how they work, right? That whole development discovery process is very regimented, very rigorous for very good reasons. And one of the big challenges is, how does digital health and digital medicine fit into that DNA of biopharma companies? That's the second, I think, big problem. And then I think the third one is the one that all businesses face. What's the ROI on all this stuff, right? So I feel like it breaks into these three things for the most part. What's my right to play? Should I be the one, contributing to this process? Will I be a trusted brand in contributing to this process? And the second one is my DNA. Is it really set up to do this? And there's lots of talk about software eating bio and all this other kind of stuff on top of everything that pharma has to deal with. And then the third one is, even if we did all this and I adjusted culture and capabilities, is it going to ever be a strong business? I mean, compared to my traditional business today, these are the three big challenges I'd say would need to be resolved before we see reimagined biopharma, right? The biopharma of the future, right? I think solving these three things will get us there.
So is there any common thread with those three challenges, those three problems, like that you say, like, this is why biopharma is having a hard time solving this?
Yeah, so absolutely, they're common threads. So on that first one, do I have a right to play? There is a lot of legacy around what we need to do as a pharma company, the evidence requirements, the regulatory requirements, and whether we should be contemplating in the practice of medicine, right? That's like a third rail that needs to be carefully examined before you touch it, right? Could we actually practice medicine in that way? And here's where I think there's a two-way street, right? There are a lot of funded startups and big tech companies, and let's just face it, big tech plus big pharma hasn't really panned out that well. Let's just put it out there, because I think there's a right to play question there. I think big tech has really pushed forward. If you haven't paid attention, I'm sure you have, with COVID, and it's a big deal for healthcare, right? Big tech has really stepped up. All the players, tele players, video players, cloud players, everybody has really done very well, and it's a good thing, right? Healthcare has been forced into the adoption of that big infrastructure. It's like GPS has finally been unleashed, right, to navigation and maps. It's the same sort of thing. So healthcare has been pulled forward by big tech, but that doesn't make big tech healthcare companies. It makes them big tech companies that are healthcare specific and healthcare sensitive and healthcare aware, right? like your healthcare clouds from your Microsofts, etc. That's a great thing, because that infrastructure releases the potential of all the other healthcare companies. So in that world, what's biopharma's role? What's their big calling card? And I would say it's a two-way street between all the technology companies that are trying to come up with digital therapeutics, etc., and all the science and the evidence and learning how to scale that process. And it's very difficult for a biopharma company, I've experienced this firsthand, to really become a software development company, a technology company. It's similarly very difficult for a technology company to become a science company, right? That can deliver. So it's going to take both sides. It's a two-way street. And that's a really common thread. That doesn't mean big pharma should just go out and run a bunch of partnerships. It means they have to carefully examine how they will either build those capabilities, where does it make sense to build those capabilities versus where does it make sense to partner. And my recommendation is you don't just want to jump in with big tech, because again, big tech isn't exactly set up to be big healthcare. You really need to kind of pick your portfolio strategy carefully as a pharma company. And then I say for the ROI side, I think it has to be done early. Like digital should not show up as a commercial problem. Digital should not show up as a market access problem. Digital needs to be part of the entire strategy from the very beginning around a therapeutic area or a category. That way, it's part of the whole process, and therefore can be much more integrated in the whole commercial return of the process. And if it's not, then it feels like one of those endless pilot situations where you're always trying things and things are not going where you can't justify them economically, right? And so that's something that could change as well. So I look forward to biopharma and biotech, Frank, becoming biodigital, right?
Cool.
10 years from now, sooner, we should see biodigital companies, you know, because biotech was a different thing than biopharma when biotech companies became this hot thing and biomedical became a hot thing. I think there is a world in the future where biodigital is going to be the way a group or a company works. So we don't have to have this kind of retrofitting at the end, painful stuff, which is the common pattern today.
So how do we get folks to feel that sense of urgency and to conceptualize the opportunity? If we wanted them to start earlier, what do we need to convince our peer executives?
I think there's a few things, right? So if you look at how many people in biopharma companies have digital or software backgrounds that are put in a position to run digital or software projects or efforts, it's pretty small. I think it's abysmal. So there are not a lot of people who have grown up as digital software natives that have enough experience working in the medicine development world, which is a very rigorous world. It requires a lot of cross-functional work. There are many groups of people who have to come together internally and externally to agree to something moving forward. That decision-making process, that culture has to be adapted. And that means new leadership that can live in both worlds has to be brought in. It can't just be people stepping into a position they've never done. And this happens all the time, Frank. It's difficult. I know that's how things have to work sometimes with enterprise culture, but it really is, it's hard to explain to people and get people moving in a certain direction if they've spent 20 years in the pharma space and they are now trying to adapt to a software or a digital world. It's just not possible. It will be the same thing the other way around, right? You've got big tech folks going into pharma companies, and 3-4 years later they're burnt out. They can't handle the rigors of going through that process or the culture required to make decisions. And so that has to change. The leadership, the culture, and the definition of success, which I can talk about a little bit more, because I think that really shapes culture. The way a company and a group of people define success is very different in a software digital world than, say, in a pharmacological product, start to finish world in that life cycle.
Well, I say let's go there. So how do we define success?
Yeah, so here's where the irony is, right, Frank? So I feel like if you look at the early digital health days when we were working on them, we were not particularly good at being iterative. I got to tell you, right? There was there was a lot of big bang bets placed, right, by the big payers, right, by some of the larger institutions that could afford innovation. There was a lot of spaghetti thrown at the wall in the early digital health days, right? And then, people learned over a course of years. I don't know, 2, 3, 4 years, things iterated, right? That was the cycle of iteration in years, or maybe months. Of course, in modern day software and products, and people are iterating on a weekly, 2 week basis. You would have heard sprint and all that stuff, right? Which is the agile culture kind of picking up in those software communities, becoming pretty much the mainstay now. That's just starting to get through into pharma. But pharma has always been iterative. That's why you have clinical research and phases. There's ways you have to go through and learn, right? But it's still in that world of almost the years side, right? The years and months side. It hasn't sped up. Software has already sped up where iterations happen in weeks. So when you bring those two together, it redefines success. Success in the digital health world, which is tied to the software world, is much more about what you can learn before the big launches, what you can learn in the first 6 months, figuring out the failures. It's good news when things don't work out while you're still going through those initial pre-launch and early launch days. That's a big deal. That defines success. How many risky things were you able to identify and sort out before you scaled? It's expected. It's good practice. Whereas if you read everything about pharma launches, they'll tell you in biopharma, hey, everybody's watching the first 6 or 12 months. And that pretty much defines your 80% or whatever, high 85% likelihood of how successful you'll be. So if things are not working out as you planned, there's any deviation, there's high risk you're not going to be as successful. And that comes into a huge clash when we talk about biodigital. So that has to be brought in. And that's going to impact the way clinical trials are designed. That's going to impact the way we bring in patients much earlier into the co-creation process of clinical trials, not just digital stuff in commercial. That's going to redefine the way we want to understand how we use data in modular and dynamic ways. How do we create agility in trials? How do we create agility in the way things are packaged? How do we create configurability into the product set itself when you launch it? Because you can't configure molecules, but you can configure digital all day long. So how do you match up this, what sounds like a really good idea, right? This thing is super reliable, traceable, configurable. This thing is super, has been tested for efficacy and effectiveness and safety. Why can't you bring those two things together? It's because the definition of success is different. It's so starkly different that when those groups meet, they can't agree on what really success is. And I think that's one of the really big things that needs to change, which is why I'm rooting for this notion of a biodigital company that has all of these things already plugged in early on. And so it's not a surprise when success is defined a certain way and everybody agrees with it, right?
Yeah, I've worked over the last 20 years for 7 different biotech companies. The thing that they all had in common was they swore up and down that they were innovative. I can't tell you that all 7 were internally. Yeah. And it really resonates with me, and I think the audience, when you get stuck in what we call heritage thinking, where sometimes we have folks around us that we work with that, well, they've never approached some of these new concepts. They can't crystallize the opportunity. They retreat to these tired out things like, well, what's the return on investment? As if everything is an if-then statement. It's a multifactorial world. These are multifactorial efforts. If you were to give advice to that innovative executive in a biopharma company right now, who might have a couple stakeholders who are holding on to that heritage thinking, what advice or what courage would you give them to thinking about what they could do if they became more of a biodigital company, as you described?
So I think you have to, that's a big question there, Frank. So I think you have to really think about where do you see yourselves as a company, right? Obviously. And I don't have that type of experience in biotech and biopharma, right? Relatively new to this space. And I've already experienced some of the, I empathize with the work that has to be done. I think someone said it, it's a miracle we ever find any drugs that work, just given how much can go wrong, right? And so the question becomes, how do you see digital as a digital first promise? And I think at first it's really a promise because nobody has really figured it out. And looking at the way the company works, from the talent that's brought in, the pipeline that's being predicted, the space that you're in. I'll pick a space like I think recently we worked with companies in NASH, right? NASH. And that's not a well-served space. It's clear patients are not very well served, right? And it's been hard for I'll just call it the traditional approach to medicine to get something out to those patients that really works, right? It's been difficult. It's this underserved space. Alzheimer's disease is another one, right? And there's quite a few of these. I think anyone in that category really should start thinking about biodigital sooner rather than later, because there's so much unmet need that can't be just addressed by the pharmacological product. It's clear it should be some other composite, right? And in order to do that, you'd have to integrate that early and try a separate space where that can happen. Really try something small. Go lean with a uppercase L, basically, right? Use these tactics that are compliant but friendly to what category you're in and how things are going. Now, there are going to be some places, I think, chronic conditions, type 2 diabetes, etc., where I do think software is going to eat bio. I think it's already happening, Frank. I think the world where, transparent care, this kind of iterative, care, patient-centered care is taking over, right? I won't mention any names, but there's some very large contenders that are eating up that space already, that are very tech-driven companies that have figured out the behavioral side of things, the, one might say, over-medication side of things, right? The lifestyle components. And because they were never scaled appropriately, but they are now, I think biopharma is going to lose out there. That's for sure. So if you're in those types of categories, you got to work out yourself how you're going to cannibalize what's happening in your business and reinvent yourself. I think that's a little more of an acute situation. But there are other areas where you need both very, very integrated, right? From the get-go, like an Alzheimer's or an ASH or et cetera. And you really got to bring it all together, because that's the only way to accelerate addressing those unmet needs. And it's also the right way to engage the clinical community, because they're also looking for those things. They're in a position where they are very open, more innovative. They're trying things, right? Versus maybe in other areas where there's a little bit of clinical inertia. People are not just as open about it. And that gives you the right to play that we talked about, right? So if you're in those areas, there's your right to play. There's your opportunity to bring digital early so that it's disciplined and it's not kind of this, non-iterative, non-regimented approach, which pharma has a good deal of experience with. And that you can create the evidence at the same time. It's complicated, but this is the right to play, the cultural shift. So that's the advice I would say. It has to be sensitive to the space you're in and the recognition that in some spaces, software is going to eventually win over. And in other spaces, it's that integrated approach that's going to make the most difference.
So Ahmed, tell me, when we find ourselves in a place where we can truly believe in this internally, how does Medullan come in and serve as our guide and help us solve these problems?
Yeah, so Medullan is a specialized, smaller firm, as you can imagine, right? And there's not actually that many fully focused digital health, digital medicine companies, right? There are some very large players that have a variety of awesome capabilities, and then there are a lot of tech companies that will offer certain things. I think we're uniquely set up to say we have been there. We've come to full circle, back to our sort of full circle, right? We've worked with and inside the hospital system. We've worked with and inside the payer system. We've worked with and inside foundations and other parties that are not non-pharma companies. And now we've spent a lot of time in the biopharma space. I'm sure we'll learn more with, we're still a learning organization, of course. And so we will bring that perspective, that realism, right? Around what does it take? What's your right to play? How could we inform those positions? How could we help you understand how to grow the capability? Some people call it upskilling, some people call it strategy, but it's all about building the right mix of people, right, behind these efforts. And we're such a small part of it that we're always incentivized to really push our clients to think about what they need to do from a capability perspective to enhance their capabilities to be more successful. So whether it's setting up these upskilling knowledge centers, whether it's actually working through specific problems in a programmatic sense, or it's about applying data and getting to that evidence iteration quicker, right? So you don't have to wait to answer all those questions. So I don't know what the financial value of this is going to be. I don't know what the clinical reception for this thing is going to be. Again, we're built to set up those outcome-driven approaches, right? And that's, I think, the best way to answer those questions. You should always be a skeptic going in. You should approach it in that way. You should approach it in an iterative, compliant way. And then you should always think about what capabilities need to be built out for the long term. Because by making those decisions, you're deliberately saying, I'm going to need to do this, even if this first one doesn't work. as opposed to outsourcing everything. And then when it doesn't work, it gets kind of unplugged and then it's rethought and then you start over with some new people, right? I think that's the worst way of doing things. So that's where I think that's how we come in, Frank.
So if I'm trying to get my team together and rally around this opportunity, what stakeholders inside a biopharma company are typically involved with your team to start heading towards the land of opportunity?
So what typically happens today is I think the commercial teams, market access teams have the brunt of figuring out digital. Somehow, the responsibility was thrust upon them. I think it's because that's where the marketing function and the kind of MarTech and where digital has a lot of buzz, and so it just happens to be them. They have to figure it out. I think that's pretty unfair. I think a lot of them have figured it out that they need to start involving other parts of the organization sooner, right? Which is great. So that's typically where it starts today. But more and more, we're starting to guide our clients to come up with cross-functional teams that can govern the digital program. So they'll have medical affairs, clinical ops, regulatory, everybody. They really need some good representation. But rather than say everybody's going to make a decision about everything, which, as you know, doesn't work very well, we've got models where everyone can participate in what makes sense, and it can be customized to the size of the company. If we're talking about a small biotech versus a large franchise, top 5 biopharma, it's going to look different, right? But really, it's so important to get that first integrated cross-functional group together. So we're guiding our customers away from, hey, it shouldn't just be commercial market access folk trying to run pilots and figure this out, and then they only talk to regulatory when something comes up, or when they sign a partnership deal, then it's driven by the partner what the agenda is, right? Doesn't become their thing anymore. All those failed pilots, etc. We're trying to guide our clients to a more cross-functional approach from the get-go, and to make sure we even out the knowledge and expectations of that group before they embark on big investments.
That is fascinating. So I'm thinking about we've got 38,000 biopharma executives in our community that want to participate in this dialogue around finding best practices, connecting people and ideas, which is great. When we ask them about some of these initiatives, and it's hard to find an initiative where we don't get this response, which is, I really wish we started acting on this earlier. And here we are once again. This is another example of an area where folks should start implementing earlier. They should start thinking out farther on who they want to be and then taking the appropriate action steps. So I guess my question would be, if you were walking into a biopharma organization that is pre-launch, there's some date in the future, how early do they need to have these conversations inside that company before launch? Like, what's the time frame?
As early as possible, Frank.
Okay.
It's never too early to start talking about digital, right? If you're pretty early, like you're talking about preclinical, you're going to have some digital strategy because of the category you're in, the therapeutic area you're in, the underserved needs of the patients. You can have a conversation about it. You can understand what's going on. You can plan for it when you get to clinical. If you're in clinical, you're going to have a conversation about digital biomarkers. You're going to have a conversation about evidence generation, right? You're going to have a conversation about how will this get clinical acceptance, etc. It's never early enough. There's always something to be discussed in a digital first kind of mindset, no matter where you are. The closer and closer you get, the more visible, I'd say, your digital investment is going to have to be, right, to the outside world, which makes a ton of sense. It kind of follows the same natural life cycle of everything else. Early on, it's going to be very much internal-based, strategic setting, maybe some partnership work, right? We're talking about 23andMe in drug discovery. So there's all kinds of things you need to do, no matter where you are. They're just going to be different, and they're going to be less visible, perhaps, right, than when you get closer to launch and then post-launch, right? But the answer is it's never too early. Gotcha.
Okay, so 3 questions as we head towards a conclusion here. And the first is, and there's going to be balance in this, but the first is, from your unique point of view, because you've got such a great background and you guys are just doing such cool work. And I love that clear-eyed counsel that folks can give when they're outside the castle walls. When when we're inside the pharma company, sometimes we convince ourselves of our own narrative. So I love that outside view. When you look to the future, you can fill in the timeline. What concerns you about what's happening in biopharma right now?
Well, what concerns me, yes. So I think we've had one of the big concerns I have is we've had our experience with big tech and them sort of fumbling, if that's to put it lightly, fumbling the ball on patient data, right, and personal data. I mean, I think we've seen that. What concerns, so that's what happens, I think, with big companies is sooner or later something big fails, and when it fails big because the company is so big, right? I think recently we just saw another 500,000 lives worth of like information was dumped out to the public, right? So this happens with the big tech side. So when we're talking about medicine essentially moving to digital medicine and biopharma moving to biodigital, one of the big concerns, of course, is how vulnerable that's gonna be. You know, there are bonuses to the way things used to work, right? In the old days. Like you didn't worry so much if you lost your candy bar cell phone because hey, you didn't have your life in it. Now it's a big different story. Of course, we have cloud backups, etc. So technology and people and humans will figure it out. But I have a very big concern about what happens when so much medicine moves to digital medicine. And because we're talking about very large companies that are very good at scaling things, that means that we might have a lot of proliferation of that. And it's not a kind of risk-aware world. It's risk-aware in a very different world. It's risk-aware on the old parameters of biopharma risk. These are new parameters, and it took bad things happening for the FDA to show up. So what will be the equivalent of the FDA with all this digital medicine goodness floating around? That's a big question for me, because today the current FDA can't keep up with everything that's going on. So what's going to happen there is a big concern for me looking forward.
All right. Well, let's give the other perspective. What are you excited about?
Well, so I am super excited about the type of transparency that's going to come out of this. I'm hoping, right? So there's an opportunity here, not necessarily from the biopharma side, but certainly biopharma could have a voluntary program around this to bring much more access to clinical research, right? Availability to patients early. Clinical research as a care option could be much more effective in this new world because of the nature of how ubiquitous technology can be, how transparent it can be. It doesn't have to be, but it should be made that way. I think that's great. I think in terms of developing countries and access to medication, it's going to be a huge deal if these things really take off, digital medicine, because it does not have the same, as you can imagine, restrictions on access, right? So that's very exciting, right? And then I think third, I think we can discover our mistakes early. I'm hoping that all of this will say a biodigital company is going to know more about what's going on much earlier and pivot, right? Like a software company does, but with the responsibility that a science-driven company has. And those are like the three big things that I'm excited about. And it's all about the human impact, right? That's the human condition being impacted. And what pharma does today is already amazing. Imagine what it could be if it's a kind of a biodigital world, right? It will be just that much more impactful.
I love it. That's fantastic. All right. Well, on that note, I'll ask you: you've got the attention of a bunch of biopharma executives right now who are looking to do innovative things. They're looking to serve patients. What closing comments do you have for them? What do you want to leave our audience with?
I will say that, I think a lot of people know healthcare is a team sport, right? It takes so many moving parts for something to happen, something to be validated, something to be in the clinician's hands, something to work with the patient, for you to discover if something's going wrong or not, right? Like some of this news we're getting on COVID vaccinations, isn't it amazing that it's not good news, right? But isn't it amazing that there's data that's coming out so quickly, that there's scientists who are paying attention, right? That information is proliferating into the public. Sure, it could be better managed, better couched, but just look at how much literacy comes from such a short time frame, and you get all this information and people know what's going on. That's amazing. That should happen with all aspects of medicine, right? And so I do think I just want to leave people with, it's a team sport. There's room to play for everybody. I do think that biopharma has a right to play. It has to be more explicit. It has to be more thoughtful, perhaps, but there's a right to play. And I think we really need that culture of rigor, science to be applied in really meaningful ways with that culture of invention and break fix of software. And then never forget that the people who have to use all this stuff are also humans, and they have expectations, right? And so by being a team sport and participating in that, I think that's where the right to play will come from. And then I think that's what's going to really create business models we haven't even quite ideated on yet. But the possibilities are really there, right? And so I think it's about pursuing this problem as a team sport.
That is great advice. You know, a life science leader's responsibility is to understand and then move towards opportunity. And you've really helped us think this through, because these are exciting times. And with exciting times becomes that responsibility, as we talked about. So Ahmed, how do we keep in touch with you? How do we find the company?
So of course, there's the website, www.medullan.com. I feel like that's like the old way of doing things now. But it's still the way people consume content today. So we're on the website. Of course, we're also on LinkedIn, as everybody else is. And again, we're also on events like this. So there are many events where we're going to be featured. We put all our stuff out, and certainly we're always open to have a discussion. We spend a lot of time just trying to find out where the need is and advising people on what they might do, even if they don't engage us fully. I think that's way okay. Again, we're all in on the team sport part of it.
Well, that's really appreciated. You know, it's always great to be able to have these exploratory discussions, because we're talking about innovations here where not every executive realizes the extent of the problem that could exist in their organization in the future if they don't start acting now. So thank you so much for your time. It's always fun sharing the conversation with you, Ahmed. We really appreciate you being here today.
Oh, it's been my pleasure. Thanks for hosting, Frank, and I appreciate the opportunity to share. And I continue to learn. So I hope people reach out as they hear about this. And I always learn something from every conversation. So thank you, Frank.
Oh, you're welcome. I learned a lot today. Well, on behalf of Ahmed and myself, Frank Dolan, thanks for joining us for this session, and we'll talk to you guys soon.
Take care.